So good evening, everyone. Welcome to another session on Ask Me Anything related to breastfeeding your baby. Myself, Dr. Tanema Singhal, and I welcome you all for another informative session on Ask Me Anything related to breastfeeding your baby. So let me first start by taking the questions which are in the Google form, and then we'll go ahead with the live questions. So first question is from Upasna Malik. My baby is not interested to latch. So basically, I understand if your baby is like initial days, if the baby is not latching on the breast and the baby is habitual to the bottle or katori or a palada, obviously the baby will find difficult to breastfeed directly. Reason being, it is difficult on the breast to latch because the baby has to make efforts. While with the bottle feeding, palada feeding, all these things, the flow comes by itself to the baby and the baby has to just gulp. So the efforts are less. So obviously the baby prefers the bottle or other things over the breast. Now, if you say that the baby is not interested, but you want to latch the baby, then first of all, for every session where the baby is taking feeds, you have to try to put the baby on the breast. I understand it will not be easy, but you have to just try in the correct positions of latching. So if your baby is less than 3 months, you can go for the cross cradle hold. If your baby is more than 3 months or 4 months and has never latched before, then don't try to focus more on the latching techniques. You just try to put the baby on the breast, however the baby comes. Even if the baby starts coming only for few seconds also, it's okay. Keep trying for that. And don't focus a lot about the techniques. It is the most important thing to at least start, the baby should start coming on the breast. Maybe nipple feeding also, I am okay with that. But if a baby who has never taken breastfeeding before and the baby starts coming on the breast, even on the nipple feeding, I am okay with that. We can improvise it later on. But if we put a lot of things like the baby should latch like this, the baby should latch like that, the baby will not latch. So if your baby has never come on the breast previously and now you want to put the baby on the breast, just keep trying on every feeding session of the baby. Along with that, lot of cuddling, lot of skin to skin, and for every bottle feeding also, just hold the baby very close to you as if you're directly feeding the baby. So all these things are required, and also you need to work on the supply and obviously the flow. If supply is very less, obviously the baby will not cooperate. If the baby comes on the breast also and the milk is not coming or the milk is coming very slow, obviously the baby will not keep on the breast for long. So you need to work on all the major things like supply, flow, and also to keep trying for these things. Recently, one of our mother from Arunachal Pradesh, she got her baby from exclusive bottle feeding towards the direct breastfeeding. So it is not like that if your baby is on bottle feeding, the baby will never come on breast. So you have to just keep trying and you have to keep positive. Now, if sometimes you're trying, sometimes not, then you can't expect the child to cooperate with you regularly. So all these things need persistent efforts, but if you do them persistently, definitely you will get results. And it is not only about this mother which I'm talking. There are a lot of stories on my YouTube, success stories you can see there, where the mothers have bought their babies from exclusive bottle feeding to exclusive breastfeeding directly. So if you are very much concerned about getting the baby on direct breastfeeding, just keep trying and keep following the tips and techniques which we advise when the mothers come to us on consultations. Next question is from Deepika. Can I start relactation after 2 months? Yes, definitely, Deepika. You can start relactation after 2 months, definitely. Next is it's not here written here. How to massage breast? How to massage B? It's not clear. I'm not understanding what is written. Next question is from Preeti. Hi, ma'am. I have been under treatment for 2 months. My baby's 3.5 month baby has started latching now, and I try to direct breastfeeding him now. I check by pressing the breast that it's empty after he has done feeding. But most of the time he cries 40 to 45 to 60 minutes after feeding. Should I just give him the bottle when he cries or again try to feed him? I am very confused because I am not confident with my supply. His formula intake has reduced and he is gaining weight fine every week. I would be very happy if my baby stays satisfied for at least 2 hours after I feed him, but that is not happening. He anyways take the full bottle when offered. Please advise. So first of all, Preeti, see, first of all, congratulations that your baby has started feeding now. And also the baby's bottle feeds are formula feeds are decreasing and baby is gaining weight. Now see, this is a transition. When you are getting the baby from the bottle towards the breast, your formula milk is decreasing and baby's weight is increasing. Right now, Preeti, what I suggest here, just keep moving. Just don't expect everything to come at all the things together. Formula is loaded with sugars. It is loaded with preservatives. And when we bring the baby on breastfeeding, breast milk is natural. Breast milk is 100% absorbed in the baby's body. So now imagine if there is a dry well. If you keep putting water, first of all the water will get absorbed in the well. Then the well will start, when the water level will start coming up. So now when you're nourishing your baby with your breast milk, that breast milk is getting absorbed in his body. That's why you are seeing that the baby is frequently demanding. It's perfectly fine. Frequent demand is always in your favor. If the baby does frequent feedings, then obviously there is more demand naturally created in your body. So right now, when you say about what you have discussed right now with me, I say you're doing really good. A 3.5-month baby coming on the increasing formula and increasing weight is very good. What I suggest, keep moving, Preeti. You're doing good. Just keep moving and just keep following the protocols which you are. Next question is from Ankita. Namaste, ma'am. I am under treatment. My son is 11 weeks old, working on mid-bottle feeding. As you say, after having half of the amount, he may cooperate better, but my son stops crying only when full. What to do? And in cross-cradle hold, he cries even more. Please guide. One more question is that I am doing oil massage and warm compress, but flow in right breast is not improving. Okay. So Ankita, what you do, you said one by one, I'll just take 11 weeks. So first of all, see, the baby is 11 weeks old. You are in the growth spurt period, Ankita. At 11 weeks, the baby will be very cranky because as I told you, 12 weeks, at 3 months, the babies have growth spurt. So during growth spurts, they demand a lot. They do frequent feeding. But during growth spurts, bringing them towards the breast is very good. That helps a lot because they are already frequent feeding. If you put them on the breast, and obviously they are very much disturbed because of the growth spurt changes like seeing colors and all those things. So this time you have to just hold the baby close to you, lot of cuddling, and this will help to improve your breastfeeding experience. So as you said that you are working on mid bottle, and after having half of the amount, he's crying. So what you can do, if the baby is not leaving the bottle at half, then you let the baby take at least, suppose you are giving 90 ml, let the baby take 70, 80, that's okay. It's fine. For sometimes we might need to do that. Just what you do, you just try mid bottle. If the baby cries a lot in removing the bottle, you give him full bottle and then you try. If he doesn't come at that, it's okay. You try next time for mid bottle feeding and try to like increase the bottle duration and try to feed in between or at the end. So this way you just need to find out what works best for you and your child. There are many babies who want their full bottle. It's okay. You just feed the baby in the last. And also, as you said, to the cross cradle hold, he cries even more. Then for now, you just don't focus on cross cradle because as I just discussed right now, when you are trying to put the baby from bottle towards breast, then right now, if the baby is not comfortable in cross cradle, at least try to put him the way, whatever he's comfortable in the breast. Be it nipple feeding also, I am okay with that in the beginning. But once he starts coming on the breast and the bottle starts reducing, then we can improvise the latch later on. Till then, just keep pumping and keep improving the milk supply, and that will be all okay. And yes, about your warm compress and massage, the flow is not increasing. Then what you can do on the right breast, when you are pumping, you start from the right breast. You first pump right breast, then left breast, and in the last, on the right breast, just pump a few more seconds, like few more minutes. The flow will improve on that side also. No worries, Ankita. Okay, so these were the questions today. Now let me see the live questions. First question is from Deepika. Hi ma'am, my baby was premature born and was in NICU for 2 months. She is used to bottle. She can latch, but my milk is very, very low. I have tried pills like Domstal, but no luck. Please help. So Deepika, for improving the milk supply, I suggest few things. First of all is about supply and demand. As your baby was premature and NICU for 2 months, the baby has been through a lot. So what you have to do now, you just try to put the baby for like whatever times the baby's like feeding. As you said that the baby can latch, so that is a very good sign. So every time the baby is demanding milk, you just put the baby on the breast every time. Now, once the baby is not satisfied or not full, and also you need to follow the active feeding techniques. Once the baby is not if the baby is not satisfied, you give the bottle to the baby, but at the half amount of bottle, you put the baby again on the breast. Keep doing this regularly and keep pumping in between so that there is more demand to improve the milk supply. Along with that, you have to improve your water intake, do massage and compress, and also take some galactogogues, which I suggest, like Lactomagic powder and Morocco tablets. And also you need to check the baby's weight gain. So if the formula milk starts coming down and the baby's weight start increasing, that's perfectly fine. That means you're going on a correct path. Follow this for 1 week. If you are able to improve, if you're seeing good results, keep doing it. But if you're not seeing very good results, I would suggest not wasting time here, because 2 months have already passed. Reach out to the team and get your issues resolved faster. Next question is from anonymous attendee. Which are the growth spurt weeks? So growth spurt weeks are 2 weeks, 6 weeks, 3 months, 7 months, 5 months and 7 months. Next question is from Ashwini. Hi ma'am, my baby is not gaining weight through my breast milk. I found out this lately, like almost after 45 days. The reason behind that I came to know was baby is taking only the fore milk and not taking the hind milk, which is very essential for growth. Baby keeps weeping after every feed. Initially, we thought it was some other things. Later only, we found out that my baby is crying out of hunger. My breast milk supply comes in drops, not flowing consistently, which makes the baby tired to suck and sleeps often once taking the fore milk itself. What to do to make the baby get the nutritional hind milk? Please suggest me. So if you have to give more hind milk to the baby, you just need to improve the flow so that the baby can empty both fore milk and hind milk. So for improving the flow, you have to do warm oil massage and oil massage and warm compress. So these two things are very important to increase the flow. Along with that, as you said, the milk is coming in drops, then you have to work on the supply also. So supply is also important here. Flow is also important here, and latching technique also is important. If the baby is taking fore milk only and it's tired and sleeps, that means the latching techniques needs improvement also. So you need to work on all these things, and I would suggest work for 1 week, see the baby's weight gain. If your baby is right now, how many months? If it is written 45 days, so I think your baby is nearly 2 months. So if the baby is less than 3 months, the baby should gain around 200 grams per week. If you are seeing, check the weight on day 1 and day 7. If the baby is not gaining 200 grams and the formula milk is not decreasing, then there is no point in trying by yourself. You can try the tips and tricks which I have told you right now, but if you don't see any results within 1 week, please reach out to the team and get your issues resolved faster. Next question is from Ankita Shastri. I am pumping the same way, right, left, right, as suggested by ma'am on last call. Still, it is not improving. Okay, so Ankita, what I would say that the dosages of medicines might be needing to change. Also, what you can do if the milk is not improving, then you can just work on like increasing your demand sessions. So are you doing all the pumping sessions all properly, like without missing any session? And the babies is just, let me see your question once again. Your question was 11 weeks. Okay, so it might be because of the growth spurt, Ankita. Since your baby is going through a growth spurt, maybe that's why it is not improving further. And that's why it is not happening. And also, you are saying that he doesn't cooperate, he cries when full. Okay. In cross cradle, and also in cross cradle he's finding difficulty. It's okay. So you just right now don't follow the cross cradle. If it is not working for you, you can just try for normal cradle hold or sideline hold, because he's now 11 weeks. He can lie down and feed also. Just try whatever feeding position is suiting you and your child. So just try to more and more of direct feeding. It will help to you to maintain the milk supply. And after every feeding sessions, you just check the color. If the color looks thick white, then obviously you have to pump it regularly. And also with your pumping sessions, if you are doing all these things and if it is still not increasing, just wait for 2 more weeks. It is 11th week running, so maybe it is because of the growth spurt. It's okay, it will improve. No worries with that. So you are saying pumping sessions are also a bit disturbed after change protocol. Yes, because when we give pumping schedules, then that is a schedule. But once the milk supply starts improving and we try to put the baby on the breast, the pumping sessions also get disturbed because we are trying to put the baby also on the breast. So here, what I would say, every feeding session you are trying. So here you can just modify in a way like this. You can continue your pumping sessions as you're already doing. Just keep doing that so that your milk supply is maintained. Otherwise, when the pumping sessions are disturbed, even that will get disturbed. Along with that, whenever your baby is demanding milk, you can try for feeding sessions where, as we have discussed, not going compulsory for cross cradle holds. You can try whatever works for you, cradle hold, football hold, or sideline hold, whichever works best for you. So these will be the bonus sessions for breastfeeding, and the pumping sessions can continue as per your regular protocol so that the milk supply doesn't get disturbed there. So you can try this. If you are not sure, you can just discuss this with your doctor. And if she says that, okay, this is good for you, then you can continue this session. So you can like continue your pumping sessions to improve to keep improving the milk output and the milk flow, and try the baby on the breast as bonus sessions to get the baby on the breast. Okay. And this is 11 weeks. It is fine. That's okay. It will be okay. Next question is from anonymous attendee. Hi, ma'am. I have twins, and one baby was in an ICU for 1 month, and now he's latching breast but only nipple. So doctor suggested to give formula and said your milk is not sufficient for twins. But he is not taking formula from spoon feeding and only accepts bottle. If I start bottle feeding, will he not take breastfeeding in future? My twins are 2 months old. Please help me to decide on bottle. It's okay. Don't worry. Don't fight right now. See, your baby, you already have twins and you're already struggling. You're already doing so much. I understand seeing the baby in an ICU is not easy. When you see a child in an ICU, it always brings so much stress, so much you don't feel good. So it's okay. Don't fight with yourself. It is not like that if the baby is taking bottle, the baby will not come on the breast. We have many success stories where the mothers have brought the babies from bottle to breast. Also, one thing, don't get so much obsessed about direct breastfeeding alone. Even with exclusive pumping, also mothers have done exclusive breast milk are giving exclusive breast milk to their babies. You already have twins. So I would suggest right now that don't worry about that. Let the babies be relaxed also so that you are mentally relaxed. You are mentally relaxed. You are emotionally relaxed so that you can work on other things. You start doing the pumping protocol so that your milk supply starts improving. Right now, focus on giving breast milk to your kids. That is more important. Getting them on the breast can be taken as a bonus later on. But right now, giving more and more of breast milk is important. So as you say that they don't want to come on the breast and they prefer bottle over breast, it's okay. It's okay because you have two babies. You have to take care of everything. A lot of things are there. So go one by one. Everything, if you try to solve together, it will become a mess. So try one by one. Right now, focus that the baby should gain weight with your milk most of the times. Formula milk, because the doctor has recently added, so that can be removed later on. So first focus on giving more and more of breast milk. And once the babies are exclusive breast milk, then we can try for putting them on the breast also. Okay. Next question is from Suhas Niranjan. My baby is 5 weeks old. She suckles for almost 1 hour to 1.5 hour with breaks in between, but still not satisfied and doesn't sleep even for 10 minutes because we had started with formula and she takes almost 60 to 100 ml per feed. So Suhas, but the thing is that your baby is just 5 weeks old, and if the baby is taking 1 hour to 1.5 hours, this is a clear indication that it is a nipple feeding or this is a very shallow latch. So you have to work on latching here because a 5 weeks old baby, obviously sometimes the mouth opening is not that wide so that they can take big bite of breast naturally. So we have to just tweak in a way that we can have the mouth open in a way that the breast, the bigger vessels of the breast can come into their mouth and the flow can be improved. So Suhas, what you have to do right now, you need to just work in a way, and because you're giving formula milk also, so there are a few things what is suggested for you is just try to work on improving the milk supply and improving the flow, and the most important part is work on the latch. If the baby, yes, so you have to watch the active feeding. So when the baby is suckling, you have to just watch the gulping movement in the neck. If the baby is gulping properly, that means the baby is drinking milk. If you're not seeing the gulping movement, your baby is not drinking, the baby is sleeping on the breast. So if the baby is feeding for 1 and 1.5 hours, I suggest to watch the active feeding only and give feeding when the baby is taking it actively. Ankita says, thank you, ma'am. Most welcome, dear. Okay, so today there are less questions. Sometimes it happens there are so many questions, it takes more than 1.5 hours also. So today we finished very fast in nearly half an hour. Good. So Dr. Swarna says how to start breastfeeding after 6 weeks of birth. So first of all, Dr. Swarna, it is not about how long whenever you feel that your baby is ready to direct breastfeed or you feel that you are ready for breastfeeding, then you can do that. So it is not about how long it has been. There are many relactation stories where the mothers, because of some reason, they couldn't start it properly in the initial days. But once they came to know about the importance of breastfeeding and also about they can still do it. They started their breastfeeding journeys. So no worries about it. You can definitely start your breastfeeding even now at 6 weeks. Okay, girls. So there is not much for us to discuss today. Good to know that we finished it fast. So I can enjoy my weekend also. Good to see you all. Take care, everyone. And take very good care of yours. The weather is changing again. So just take very good care of yours. So okay. There are 2, 3 more questions. So Dr. Swarna says, ma'am, baby doesn't like to latch on the breast. It's okay. Just your baby is 6 weeks old now, so it would be a growth spurt change also, Dr. Swarna. So every feeding session, just try to put the baby on the breast. Along with that, create the demand by doing more and more of pumping. नुसरत says now my baby is crossing 10 months और मैं अब हार गई और उसे ब्रेस्ट फीडिंग ऑफर भी नहीं करती अब वो टोटली डिपेंड है फ्रॉम बॉटल फीड मुझे बहुत अदीस है तो नुसरत ऐसा क्यों सोच रहे हो बेटा अगर 10 महीने का बच्चा है कोई बात नहीं आप अभी भी फीडिंग करा सकते हो और जरूरी नहीं है कि आप डायरेक्ट फीडिंग ही कराओ आप बच्चे को माँ का दूध मिल रहा है ये इंपॉर्टेंट है ना तो अगर आप बच्चे को पंप करके भी दूध दे पाओगे तो भी अच्छा है नुसरत ऐसे क्यों परेशान हो रहे हो 10 महीने के बच्चे को आप ऑब्वियसली फीडिंग करा सकते हो आप बच्चे को माँ का दूध दे सकते हो आप एक काम करना अभी इस कॉल के बाद इस सेशन के बाद जो अभी हमारा यूट्यूब चैनल है वहां पे किरण की स्टोरी देखना उसका बच्चा 2.5 साल का 2 साल प्लस का था जब वो मेरे पास आई थी रीलैक्टेशन के लिए तो जब वो 2 साल के बच्चे के लिए कर सकती है तो आपका बच्चा तो अभी 10 ही महीने का है कर सकते हो नौजत इतना परेशान हो ऐसे क्या होता है मैं हार गई ऐसा मत सोचो ठीक है ऐसा मत सोचो आप कर सकते हो अभी भी कर सकते हो अभी भी उम्मीद है आपके पास सो डोंट वरी अभी आप बिल्कुल परेशान मत हो नजर लेकिन अब अकेले मत करो क्योंकि अकेले करने में क्या होगा अगर थोड़े रिजल्ट्स नहीं आएंगे फिर डिप्रेशन होगा फिर स्ट्रेस होगा तो टीम को पहुंचो टीम के साथ बात करो उनके साथ अपना अपॉइंटमेंट लगाओ और वो जो बता रहे हैं उसको अच्छे से फॉलो करो और अच्छे से रिजल्ट आएंगे Suhas Niranjan says, ma'am, if I try to pump, at least I get 60, but after 2 hours, if I try to pump, it's only 20. What to do? So don't worry how much milk you are collecting. Don't be obsessed about the quantity of breast milk. See the baby's weight gain. If the baby is gaining weight and the formula milk is not increasing or the formula milk is coming down, you're doing good, Suhas. No worries with that. My pumping time is almost 30 to 40 minutes. So as you are doing so much of it, 30 to 40 minutes. My God, I recommend usually mothers 10 minutes of pumping. So if you are doing for 30 to 40 minutes and you're collecting 20 ml or sometimes 60 ml, it means you need proper guidance on pumping protocols. So if you have done this for 1 week or more, then there is no point in waiting for yourself. And because I know by doing this, if you keep continuing the same thing, after a few days, you will feel demotivated and you will feel like quitting. So better is to reach out to the experts and get a proper pumping schedule for yourself so that it can work for you. Okay, girls. So that's end for now. Take care, everyone. Bye-bye.